So Chuck, first of all, I know you know what a pleasure this is for me to be in the position of interviewing you. Not only are you one of my favorite people, but you're our first fellow, and your success has been our success. So I thought, to begin, why don't you tell us really how you got into this business? How did you end up getting into neurology and movement disorders?
So it really started, I always wanted to be a doctor. That's the one thing I always felt that I wanted to do. And my grandfather had Parkinson's disease. And he died when I was 13 years old. And I remember writing an essay for, I think it was 8th grade English class, where I said that it was a retirement essay. What were you going to do when you retired? And I said that I was going to retire when I found the cure for Parkinson's disease. And I wrote an essay, and actually you've seen that essay, and you may remember that.
What was the name of the doctor? I remember you.
The name of the doctor was, there was Howard was in it, and sure enough, he was one of my mentors. And my wife's name was Lori in the essay, and my wife's name is Laura. So there's a lot of overlap there, but it was really my grandfather inspired me to study Parkinson's, and my father is a PhD neuropharmacologist, studies opiate receptors, and I spent a lot of time working in his lab. And at that time, I made a decision. I was interested in neuroscience, and went from undergrad. I went up to NYU School of Medicine, did an MD and a PhD, and instead of doing opiate pharmacology like my father did, I did neurotransmitters, mainly noradrenaline. With
you did your PhD before your MD? Was it an MD PhD?
I did it combined.
It was
combined. The medical scientist training program. So it was a 5-year MD PhD program at NYU with my mentor there was Menek Goldstein, and he was very, very well known for finding an antibody to TH. But he put me in the lab working on noradrenaline instead of working on dopamine.
Well, tell us about that. That was with Menek Goldstein, who everybody in our field knows who he was because of his contributions. What was that work like? And what was
it was interesting. So my relationship was so-so with Menek. Menek was a really tough guy. I was his only grad student. He had a number of postdocs in the lab. So a lot of people who he told which experiments to do, when to do them, and I was a go-getter. My goal was not to stay in school as long as possible. My goal was to get out as quick as possible. And I used to run 2-3 experiments in a 24-hour period. My wife was in med school. And if she was on call through the night, I'd stay in the lab through the night.
And what were you working on exactly?
So I did synaptosome release of norepinephrine from synaptosomes of brain preparations, and we were looking at receptor reserves. So we'd knock out a certain number of receptors and see what it took to still release the norepinephrine. And I was the first person actually to do that in brain preparation. So it had been done previously in the heart. There was some work in the heart, and actually that work, the person who did that was on my PhD advisory committee. But actually the time in the lab, I really loved the lab, having worked in my dad's lab, Menek's lab, but it became pretty apparent that I very much liked human interaction and working with people much more than I did working in a basic science lab. And
was this a decision that this occurred during medical school?
That occurred during the MD PhD program.
Right.
So I also had spent a summer with Amos Korchin. We did pupillary work, and a lot of people know Amos for all his work in Parkinson's and whatnot, but he was a neuropharmacologist, and he and I did some work with opiates back in 1978. But after all the lab work, I realized I really was much more interested in patient-related research. And the good thing about the MD PhD program is it really taught me the basics of how to do research. I think I learned a lot about mechanisms, learned a lot about protocols, a lot about statistics and whatnot, and that's done me well. For my career.
At that point, you were lucky enough to come to the best neurology program in the world, right?
I was. the two places that were pulling me were to stay in New York and be at Columbia and go there, or move back. I grew up in Philadelphia, so moved back to Philadelphia and go to the University of Pennsylvania. So actually, my wife wanted to stay in New York. She was going to be chief resident at Beth Israel Medical Center there, and I convinced her it was better if I got into Penn to go to Penn, and I was fortunate enough to be accepted. Interesting aside, back then I got accepted into a neuro-residency program at Penn prior to doing any rotations, because as an MD PhD I only did 12 months or 13 months of rotations. So I got into Penn, and then I started doing my clinical rotations, and I realized that I really like cardiology. And I wondered during my year of doing rotations, should I switch from being a neurologist to a cardiologist? And there was a woman neurologist at NYU who said to me, you wanted to honor your grandfather, you wanted to find a cure. She said, go back and read the book Awakenings, which I had read, and it was really very meaningful to me. So I did. I went back probably in December of that year and reread that. And during that time, I realized that, yes, I did want to be a neurologist, cure Parkinson's disease, so
was the Parkinson's part of this? Did that continue through your residency? Were you
Yep.
determined to do that all through residency?
Always determined. What I kept trying to do ever since I was a little kid was find something else. I found myself reading newspaper articles about Parkinson's disease. Anytime that the term came up or a patient was in the hospital with Parkinson's, that was what was most interesting to me. And even when I was a resident, when I started residency at Penn, I got the nickname Cecil B, because whenever there was an interesting movement patient, any patient that had abnormal movements, I'd go find the video camera and I'd start videotaping those patients. So while Parkinson's disease drew me, one of the best parts was neuropharmacology was so important to the treatment of patients with Parkinson's that it drew me the whole time. It's never left me.
And so here you are, you finish your residency. We don't have a fellowship at this point.
Correct.
And there are a few fellowships, not many.
Correct.
But we're starting one. And I forget what your decision-making process was back then.
So I went and did, as a neurology resident, I went and spent a month with Stan Fahn. And that would have been, I guess, maybe 1989. And Stan Fahn Stan's program was probably the best program in the world at that point, certainly the first fellowship. And there were some very influential people there. Susan Bressman was a young member of the faculty. Mitchell Bryn and Paul Green were fellows at that point in time. And that 1 month was unbelievably exciting. Stan had this tremendous stature in the field, obviously, and yet I would be sitting in the fellows room, and if he wanted me to see a patient, he'd find me. So I didn't have to be standing outside his door. He always looked for me. He was very insistent on people filling out rating scales. He had a database that he was keeping of rating scales. And I came back to Penn at the time, and you and I talked, and I talked with Howard, and the question was, do I go up to Columbia to be a fellow there and then come back to Penn, because my goal was to stay at Penn, or do I become your first fellow? Or, as you may remember, I said, well, maybe I don't need to do a fellowship, just put me on faculty. I'd be happy just to go on faculty. And since fellowship was the hot thing to do, we decided together that I should be your first fellow. And my wife liked that idea because we had bought a house, and she liked the idea of staying in Philly. My family was in Philly. And I became your first fellow.
And tell me, and what do you remember about the work you did? Because we were all kind of new at this ballgame in those days. We were building a program, but we were doing some clinical research, and we had some cool things going on. What do you remember about those?
I remember that my
That
fellowship year may have been the best year of my career. It certainly was the most enjoyable. You and Howard were tremendously accommodating. You loved teaching. It was, I'd see a patient, you always made time to see the patient and go over things with me. In terms of research, in terms of clinical practice, Botox had just been FDA approved.
Right.
So as I tell my trainees, nobody taught me how to do toxin injections. You and I and Howard, we went into the patient room. We said, well, I think we should do this or do that, and that's what we did. And so we learned by trial and error, and that was great. We studied pain in patients with toxin. We did a project on amantadine. At that time, you said, let's revisit the issue of amantadine. I think we have some patients who responded well, and maybe dyskinesias improve with amantadine, and I went and reviewed some charts, and we wrote that
few
up.
people know that may be one of the earliest, if not the first definitive observation.
It was one of them,
right?
yeah. I remember Kathleen Shannon had a small paper, but yeah, that was one of the first papers ever written on amantadine use in dyskinesias and motor fluctuations. And then I did probably for me, the best paper I had written at that time as a fellow, you may remember, we looked at MRI and MRA in patients with hemifacial spasm. The neuro-ophthalmology group at Wills Eye Hospital was really great, and we had a tremendously good imaging center at Penn. And so we looked and we saw that some blood vessel, evidence of blood vessels compressing the seventh cranial nerve. I think it was 66% in the hemifacial spasm group, and I remember writing the paper. It was published in Annals, and getting a letter from the neurosurgeon at University of Pittsburgh who did,
Janetta?
Yeah, Peter Janetta wrote me a letter, and he said that was a really interesting paper, except every patient has compression of the seventh cranial nerve, and he said the MRI was interesting, but surgery is the best.
Yeah. So you finish your fellowship,
I
and
did.
now the big dilemma: what to do now?
Well, the big dilemma,
Big dilemma
was
for
all you're doing. I'm fond to say.
Thank you.
You were a wonderful mentor, and what you said to me was, this is one of the few times in your life you may have to look for a job. You know, moving family. At that time, I had one daughter who was 3 years old at the time, and you said. I said, well, don't I have a job at Penn? And she said, absolutely, but I wouldn't be doing my job if I didn't tell you to think about what else you would like. And I remember the only thing I was missing was warm climate. I hated the cold. I was from Philly. I had trained in New York, and I had been born in New York as well. And so you said, well, take a look around. So long story short, Mayo Clinic had recently started a branch in Scottsdale, Arizona. I wrote to them. I think actually you told me they were looking for a movement disorder doc. At the time, Manfred Munter, who is a Parkinson's disease, one of the leaders in the field of PD treatment, he was chairman. He had started the Department of Neurology there, and he recruited me. And after my first visit after Thanksgiving of 1990, when it was nice and warm and whatnot, I came back. I mentioned my wife and I were shocked that we liked it. You tried to convince me to stay at Penn, and I went back to visit Manfred, and what convinced me to go there was two things, but the most important thing was we sat in a hot tub in the middle of February looking at the mountains outside of Mayo Clinic, and he said, can you imagine what we can do here with Parkinson's disease? We have a big retirement community. Mayo Clinic is just starting, really, and you'll be at the ground floor and you'll be able to build something. Much like you and Howard had built the Movement Disorder Center there, it was something I couldn't resist. So the 5-year plan turned into, it's been 26 years now.
You've been there 26 years,
Yeah.
amazing. And what would you say, I mean, you've done a tremendous amount there, and there's a lot of interesting work that's come out of your program. What would you say is if you could pick one or two things that were really the highlights or had been the highlights of your research contributions from the Mayo, from your experience there? What would you say it's been?
Yeah, I think from a research standpoint, one of the things I've loved so much is a collaboration that I have. So we built a collaboration, we called it the Arizona Parkinson's Disease Consortium. And when we started back in 2001, it was multiple different centers, but specifically Mayo Clinic and Sun Health Research Institute. And there was a neuropathologist there, Tom Beach, MD, PhD neuropathologist. So he essentially, over the past 20 years, I started with him in '97. He was the neuropathology core and I was the clinical core. And Mayo allowed me to go out there once or twice a week and work out there. I did all the clinical evaluations of individuals who were signed up to donate brains and now bodies. We were looking at Parkinson's disease, dementia, and control. So number one for me is having built up a clinical database and a tissue resource that's number 1, 2, 3 in the world in terms of Parkinson's tissue, dementia tissue, and control tissue. Out of that, our most recent research went from the lab to the clinic, which was we found that alpha-synuclein was present in multiple different organs in the periphery, so it's not just a brain disease, it's a systemic disease. And we looked for a biopsy site, and we have now found that we can biopsy the submandibular gland and find synuclein present in patients with Parkinson's. So from a truly research and clinical impression standpoint, that's my favorite thing that we've done. From a fun part, I got involved in researching the yips, so golfer's cramp. So out of my interest in dystonia and focal dystonias of the hands, task-specific dystonias, I've been working trying to find a diagnostic method to identify golfers who, when they twitch or jerk, actually have a neurologic cause instead of a psychological cause. And my hope is then to try to find treatments that we can identify to help them.
And that work may make you more famous than the Parkinson's work, right?
To now it has. It's quite amazing what the media picks up on.
Yeah. So let me ask you about the society, because we're here at the Congress, and you've done a tremendous amount for the society. How did you get involved in the MDS?
Well, I found the Movement Disorder Society, first of all, it started when I was in training. And so I've really been able to watch the growth of it through my career. The Society has always mentored young people. I have been mentored by Joe Jankovic, Chris Getz, Tony Lang, and obviously you and Howard as well, but people that were not my direct mentors in terms of being in their training programs took me under their wing. They always pushed. Ali Rajput, a tremendous mentor to me in terms of being supportive. And as the years went on, there have been multiple different aspects of the society that I've become involved in. Bylaws committee, working with development, and then over the last few years working in education. So being on the education committee, and most recently spent 2 years as vice chair or co-chair, and more recently 2 years as chair of the education committee. As I tell my wife, because it's taken up a tremendous amount of time, truly one of the most satisfying things I've ever done. And the idea of being able to bring education, so much like we have a family tree, you and Howard have mentored many, many fellows, and out of those fellows like me, we've mentored fellows. Education of people around the world through the various different MDS initiatives, so standalone courses. We've created a tremendous amount of web-based educational programming, CME, non-CME, video. It's just been a tremendous delight to be part of it. And now I'll move on to the IEC, the executive committee, where I'm hoping to keep pushing forward that agenda.
And do you see yourself sort of staying in this path for a while? Is there anything that you would do differently if you had to go back, other than staying at Penn?
People always ask, being a doctor these days, it's so horrible, and there's so many roadblocks that have been put up and whatnot. There's nothing I'd rather do. Actually, the one thing I always say is, if I could be Bob Costas, I would have loved to have been a sportscaster. But the opportunities that the field has given me has been great, and just from the fact that one of the beautiful things about having gone to Mayo is work-life balance. Mayo is a very family-centric organization, and I've had the opportunity in Mayo to be home every night for dinner with my wife and my 2 daughters. I've been able to be home on weekends. I've had the ability to adjust my work life to fit my home life, and that's been a really wonderful thing. So to me, I wouldn't do anything different. I love being a neurologist. I love trying to help patients with movement disorders, and the only thing I wished would be that we were closer to a cure for Parkinson's, because I actually would like to retire fairly soon. And I said I wouldn't retire until I found a cure for Parkinson's disease, so I'm not sure.
Well, I hope you realize it, because we all will benefit from that, obviously. And I have to say that being your friend and your colleague and watching your career evolve as it has been one of the greatest joys in my life, in my professional life.
Thank you.
And this is a highlight to sit here and sort of remember it and rekindle it with you. And I think you've done phenomenally well, and I think there's still a bright and glowing future. So
I think so as well, but thank you.
Thank
you. I appreciate that.
Okay.